what is this session about? This session is about the dialogue between research and practice, because I think that we would absolutely, none of us would have doubts that research plays a very important role in global health research. But then the question is, how do we do it best in dialogue with communities, and how do we do it best in dialogue with policymakers? Just before we started this session, I don't know if you noticed, a colleague walked in, somebody who actually works in relation with practice, and it's somebody who attended one of my courses a few years ago, and he just came in to say hi. And this really reminded me of how close research has to be to the world of practice and policy making. And what we're trying to do today is answering exactly these questions. How can we do it best? What are the enablers? What are the barriers? And how can we overcome these barriers? And having said these few words, I would like to let my colleague Walter speak more specifically on how the session will be structured.
Yeah, good afternoon also from my side. You've heard why we want to talk about the relationship between science and politics, policies. But what about the country-specific experiences? Well, in global health, we always or often look for these global solutions. And some of the challenges can be really only tackled on a global level, like the development of tests, of medicines, of vaccines, and so on. But when it then comes down to implementation, we all know that there are enormous differences between countries. That's quite a commonplace in health systems research. It makes a difference whether you have a centralized or a less centralized political and health system, the colonial past, whether you had been a French or a British or a Portuguese or Spanish or Belgium or Dutch colony is really felt until today. Then you have, of course, due to this state-run health systems and health systems that are rather based on a market model, and all this really makes health systems largely different, as you all know, and therefore we are really interested in the country-specific experiences, in examples from several parts of the world, and therefore I'm quite glad that we have this panel here with so many different experiences. We will introduce the panelists before they give their short talks. I just want, before introduce you a bit into what you have to expect here at this panel. So first, all the four speakers will give a very short input of not more than 5 minutes, and we are waiting still for the slides that should support these inputs. It's working now. And these inputs will answer the question, what does an effective cooperation between researchers and policymakers mean for you, according to your experiences? Not any theoretical level, but really according to your experiences, what matters most? And where are the most important learnings, best practices from your own personal and professional experience or in your own current position or program? Yeah, after this, we will have a short round of questions within the panel, and then we will open it to you in the audience in order to get perhaps even more experiences also from your side. Yeah, so the first speaker will be introduced by Manuela again.
Lots of standing up and sitting down, I feel. So it's actually my pleasure to introduce Dr. Zubin Shroff. I've had the pleasure and the honor to work with him. So he's a health system specialist working at the Alliance for Health Policy and System Research. He has over 10-year experience in the areas of health governance and health financing, human resources for health, and access to medicine, working closely with governments with different countries, both to produce and to make and use the evidence that is being produced. So, Zubin, the floor is yours. I stand here. The slides will start.
Thank you, Manuela, for this introduction, and thank you to everyone for coming for this session. It's great to see this turnout. So, yeah. Oh, sorry, back. Yeah. So I'd like to take this opportunity to present some reflections on research to policy processes, focused by an example in India, and then I'll offer some reflections on that process. And evidence to policy processes have often been framed in terms of, and this is a framing really informed by a very technocratic view of this process, as push approaches. The evidence is what's important, you provide it to policymakers, they take it up, and this is complemented by pull approaches where you train people in taking up evidence, and that's what's the most important factor. And I argue this has several limitations, and one is, of course, these approaches don't adequately look at the individual incentives and institutional incentives of policymakers to actually use evidence, and I'll reflect more on what I mean by this. It doesn't look at power imbalances between researchers and policymakers. The power imbalances in terms of what is researched, who frames the questions, who decides something is a problem. We typically look at researchers deciding what to research, providing it to policymakers, and then it's unsurprising that policymakers aren't particularly interested. It underplays the importance of politics and evidence to policy processes, particularly how you need to have evidence available at particular windows of opportunity to actually provide at that moment. We can't just expect, again, policymakers to be waiting for our evidence, but our evidence needs to be ready. And linked to this, it ignores the fact that policy evidence to policy processes really need to be part of a broader learning ecosystem and not standalone processes that are independent from a larger learning ecosystem where research contributes to policy and evidence. And the Alliance for Health Policy and Systems Research has been really pioneering the embedded approach to health policy and systems research. And I'll quickly explain what I mean by this. It's research conducted in partnership with implementers and policymakers, integrated into health system settings, taking into account context-specific factors to ensure greater relevance. And the idea really of this approach is to lead to this learning ecosystem that I mentioned above, where researchers and decision makers are connected at all times, and decision makers can reach out to this researcher network in their own settings to provide them evidence as policy processes evolve. Now, I'll quickly discuss the example in forming India's national health insurance scheme. And the aim here was very much to support program implementation, course correction through relevant evidence. We were tasked to inform the early implementation of the program and improve the program guidelines and improve it as it was being rolled out. And we had to respond in line with implementation timelines. And this is really an important feature in evidence to policy processes. You cannot have the luxury of years to do your research. Policymakers need their answers quickly, and they need them now. How did we do this? We really worked with research, with the policymakers in the scheme implementing agency, the National Health Authority, to identify research themes. They actually consulted their own implementers at state and district level and really systematically identified research priorities, worked with them throughout the process in a partnership model to actually ensure that we got the right data, and had dissemination bringing together national and state level implementers, and studies were developed into working papers for policymakers highlighting the main findings. We had impact in terms of supporting course correction around benefit package design, around improving awareness through addressing supply side constraints, nuanced understanding of different purchasing arrangements, just illustrative of the kinds of changes this kind of rapid research could do. And systemically, we helped to build a sort of culture of evidence by the National Health Authority, the implementing agency, actually incorporating a research unit into their day-to-day functioning. And the proof of the pudding for me was enhanced partnerships. We had the team actually develop a second round of research, was really led by the government, took this forward and took it ahead, seeing the proof of the first round of evidence. Now, what is the reflections from this? I think that's what's the theme and what we were most interested in. One is about the role of leadership and the early engagement of the senior policymaker who really pushed this. And this is not something I'm claiming you can just do magically find that policymaker, but I think it's important when you build critical mass of capacity strengthening of a large number of people, you sort of generate and sensitize a sort of interest, which is important to actually be able to do this. A second, I'm not underplaying that this can't be done the same way in every setting. You need to have a critical mass of research capacity in country to actually do this kind of work. An important factor is you need adaptability and flexibility on the part of stakeholders. And what I mean here is policymakers are not often used to dealing with uncomfortable findings, particularly in many of the settings we work in. have to be willing to hear things that are uncomfortable in spaces that are safe. Researchers, on the other hand, aren't used to being told what to research and how to research it. I mean, so again, this is not applicable, I'm just disclaimer, for all kinds of research. Basic research has to be done completely by researchers. But in terms of doing policy work, the sort of flexibility, including researchers in policymakers and research processes, is something which requires a lot of mental shift or changing of mindsets to do this. Just a clear communication between different levels of government, because again, the national policymaker may want this, but if people are used to providing findings that please their bosses, you're not going to actually come to the truth of it. And actually clear communication was a very important fact right from the capital to the program implementers at the community level. And finally, trust at different levels, and trust between the implementing agency, that is the policymakers, the program implementers, and the research partners. No policymaker wants to give you data if they think you're going to do an investigative scoop on their schemes. On the other hand, similarly, no program implementer is going to tell you the truth if they perceive this as a sort of performance appraisal. So the sort of importance of creating safe spaces and linked to that whole sort of mindset shift is something that I think was crucial in this process. So that's it from me for my initial 5 minutes. Thank you.
Thank you.
So we're living in India, and we're going to Nigeria. And it's really my pleasure to introduce you to the Director General of Nigeria Center for Disease Control and Prevention, Professor Ifedayo Adetifa. And he has extensive experience in epidemiological research, both on the control of childhood illness and vaccine in different Bereich, I'm thinking German, I'm sorry, in different areas of vaccine prevention and epidemiology, and we're extremely honored to have him with us today. Thank you.
Thank you very much. Thank you very much. Okay, so I'm supposed to describe the Nigeria experience, but perhaps I should explain a bit of my background. So I have been an academic, okay, so spent time at the Medical Research Council in the unit in the Gambia, then moved to the London School, but was based at the Kemri Wellcome Trust Research Program in Kilifi for 10 years, 8 years, and then I'm now in a sort of public health government role. Now, when I was a researcher, I had significant frustrations trying to understand why government public health authorities or immunization programs or TB programs were not interested in these nice cutting-edge results that we were producing, and how, you know, when you try to engage even at the beginning to try and tick the boxes on why you should collaborate, it wasn't received with as much enthusiasm as you'd. And I've had this problem in 2 countries. But now I'm on the government side, and I realize that I don't actually have the bandwidth to deal with all of the interesting research projects that need to be done, especially when I need to respond to Lassa fever outbreak or meningitis outbreak and so on and so forth. So I hope, you know, that gives a bit of an understanding of how we shouldn't point fingers and complain without taking into account that the other 3 or 4 fingers are actually pointing at you. So, so very quickly, it's the usual question about how do you crack the that knot that is the research policy nexus, and the idea. I don't subscribe to the idea that every research is translatable. So, I mean, I think a bit of that has been mentioned here, but not all research. But we're talking about, you know, public health research from my perspective, which should inform or provide data for action. Okay, so for us, you know, we need to unlock this if, from my perspective as a health security agency, that we achieve the full potential for health security and global interventions. And I think that a key component of that still remains the early involvement of policymakers in research processes, including co-development of the question, because the big challenge often is that alignment, as important or as often neglected as it is, it's the critical knot that needs to be. Okay. So if your research is not aligned to policymaker country priorities at the time, then you're never going to get the enthusiasm that you need. And unfortunately, as we know, funders have their own agenda. We often have to write innovative research proposals that qualify as 5-star science and all of that. And believe me, at the end of the day, those proposals and projects are not what countries need. But funders in other parts of the world who drive the agenda also contribute to this misalignment. So, dealing with the research policy nexus, as I've said here, is not theoretical. We really do have to take steps and actions to address this challenge. And I think, again, I'm glad that there are commonalities between what I'm about to say, and what the example from India, that to achieve effective collaboration, you do need data sharing, you need research to be truly collaborative. You need to keep an eye. So if you're a public health researcher who's interested in data for public health action, then you need to keep your eye on policy monitoring and evaluation. All research findings, gone are the days where you celebrate every New England Journal paper or Lancet paper. You look at PubMed, finally it's on PubMed, and you say, yeah, I'm done. Let's move on to the next proposal. Research findings have to be made accessible. Policymakers don't read journal articles, okay? And scientists don't write the best journal briefs. I've been guilty of writing what I thought was the, grade 12 policy brief. And when I had cause to look at it again, I thought, oh my God, no wonder the man was looking at me like, where's this alien from? But, so we need to make research findings accessible. We need regular communication, and certainly the community engagement, the creation of community demand for your research findings and your intervention is important and can only be achieved through policy engagement. So if we speak about the Nigeria Center for Disease Control, we are mandated by law, by the law that set us up to conduct public health research, which is good. It doesn't mean I'm going to do it very well, but it is good to have some background. And the idea is research then also needs to be context-specific, and I've talked about the misalignment between funding, research funding, calls and priorities. Yet, you do need to achieve representation and still somewhat be innovative. And then it is important to tell your own stories, as the case may be. That's also a bit difficult because the publication sphere is also looking for different kinds of papers. So you get frustrated by the number of rejections you get. But thankfully, there are lots more global health journals that take these narratives. So to summarize, I think that bridging the gap between research and policy is possible. Unfortunately, at the moment, there's significant ways of travel. It's still quite aspirational, but action is needed. And some of those actions include data sharing, making research findings accessible, be truly collaborative, regular communication, not just when you're about to write the proposal and when you write the first paper. We need continuous engagement and to ensure that there's cooperation. One innovation is to have legal backing, but that, of course, applies to my context and to my agency. I think every university and everybody else has their own, they have their own remit and TORs. And to get high-level commitment to policy making, multi-sectoral coordination, evidence-based policy making, and regular public engagement has been noted in our experience to support infectious disease response in the country. And when we have a challenge like we have with diphtheria, again, our learning is that there's been a bit of a gap between us and the community in terms of, well, the disease wasn't there before, so there previously wasn't any need to discuss it. But now that it's here, we have been quite slow in engaging them and in doing the studies that we need to do and all of that. So we've got quite a bit of work to do to overcome that so that trust is established, and then we can go on to do research that's relevant, especially in an outbreak setting, to the control of that outbreak. So thank you very much.
Yeah, thank you. So we remain in West Africa, but move to another country. It's a pleasure for me because Ghana is really the main research partner of our university in Bonn. So I have the pleasure to introduce Dr. Augustina Angelina Silverkin, who is a senior lecturer there in the Department for Theoretical and Applied Biology. She has worked during her PhD also at the Bernhard Nocht Institute in Hamburg and at the University Medical Center in Bonn. And besides being really a renowned expert in virology, that means also that she was quite influential in the COVID-19 response and research in Ghana at that time. She is also engaged, interestingly enough, in STEAM, in science, technology, engineering, and mathematics for women to encourage them for a career in these fields where they are so far not really well represented. Yeah, the floor is yours.
Thank you very much for that introduction. So thank you to the organizers for giving me the platform to share my experiences on research and policy in global health. Yes, and so I'm from KNUST, I teach and I also conduct research. So I guess I'm somewhere towards the researchers. But we all know that as for research and policy, they are so very important, especially when we want to solve issues pertaining to global health. And again, whereas research is interested in generating the data, the hardcore data, the evidence, policymakers or policy actors are always interested in churning the data into guidelines, into systems, and into structures. So we can find this unique relationship. I call it a bidirectional relationship where policy feeds into research and research also feeds into policy. I also like the situation whereby you find researchers and policymakers. I think this is the best fit. So researchers and policymakers working hand in hand, getting the information and then, churning out the guidelines. This is the best fit. Unfortunately, most of the time, we find researchers, policymakers doing their own thing. So they work in silos. And I don't think this is a situation we really want to see. So I'm not interested in this particular scenario. Maybe I'll be interested in the bidirectional and then the very nice relationship we have between researchers and policymakers. However, I need to make a point that, look, what we find in books pertaining to policy formulation and implementations, unfortunately, is not what we see in real life. So the question is, how do we then engage with policymakers? I am saying with policymakers because I'm a researcher. So how do I involve or engage policymakers so that we can cooperate effectively? And I have some few points. I think my brother from Nigeria, we call them brothers from Nigeria, made a couple of points, and I think Zubin as well. I think that it's important for both parties, researchers and policymakers, to set the priorities, the agendas or the agendum pertaining to whatever global health challenge we want to solve. So that when it comes to the generation of the research question, we need to share objective, we need to share goals, we need to show effective commitment. Because if we are able to do that, then hopefully we'll be able to solve these issues pertaining to global health. And I think that even when we are setting out the agenda, the priority areas, the research agenda, we need to communicate effectively. We know that as for researchers, we are interested in using jargons, terminologies, hardcore scientific language. Unfortunately, the policymakers are not interested. They don't even understand. So we need to communicate effectively so that when we are setting the agenda and we are organizing our workshops and our conferences and our meetings, we need to call the policymakers in. Likewise, when the policymakers policymakers are conducting or having they call it annual peer review meetings and whatever meetings, they need to include or involve the researchers so that hand in hand we'll be able to share ideas and draw the path or chart a path for global health. Data sharing. I mean, we love to see our statistically significant values, but the policymaker might not be interested and might not even understand. So it behoves on researchers to really spell out the data in a digestible form for the policymakers. We need to build our capacities. I mean, for a researcher, I'm interested in building the capacities of my research team members. But how about the policymaker? Because at the end of the day, we want to survive in this ecosystem whereby I can produce the results, and then together we produce the results and we churn out those policies. We need to be adaptable and flexible. Researchers are super glued to their own unique ways of doing things. But just so we meet the expectations, and this expectation has to do with the expectation of a researcher as well as the expectation of the policymaker. So we need to be highly adaptable and flexible. And of course, when it comes to ethical issues, I don't want to go in there. But collaborations, most researchers and policymakers, we are interested in South-North collaborations. They are very good. But when the issues related to global health, they tend to be restricted to our unique environment, then it becomes very important for us to look within our country. This is not meant to say, or this is not to say that South-North collaborations are not good. They are excellent. They have the skills, they have the expertise, they have the infrastructure. But I think that when it pertains to issues related to in-country challenges, then it's important that we also look within our unique country. So collaborations are also very good, especially if we want to collaborate or cooperate effectively as far as researchers and policymakers are concerned. So for me, what really stands out are these three critical areas. So breaking the barriers, so barriers related to communication, barriers related to the things, our high expectations, barriers related to communication, barriers related to all the other things that relates to global health issues. And then when it comes to setting out those priorities, we need to do it together. And we need to include each other, policymakers and researchers. So I decided to use this as an example. I think this is a very clear example of how in Ghana we're able to, together with policymakers, churn out data for WHO on the level of drug-resistant tuberculosis. And this was for the first time in Ghana pertaining to drug-resistant tuberculosis. So we have two groups, the researchers, so KCCR were the implementers, and then in terms of the policymakers, we had the National Tuberculosis Control Program and, of course, the WHO. And so we had to develop the proposal together. We had meetings. We had a lot of engagement. We shared a lot of ideas. So we set the priorities right from the onset or right from the outset. And at the end of the day, we're able to generate data. And now this data was beautifully churned into policy by the policymakers. We still sit on their boards. There are several boards in Ghana pertaining to several studies related to policies that you find a lot of researchers sit on. And of course, at the end of the day, we had our policymakers also finding their names on a paper, an article in, I think, a highly rated journal. Thank you very much.
Yeah, being the German Alliance for Global Health Research, we want to have, of course, also the German perspectives represented here. And therefore, it's an honor for me that our long-standing supporter, in a way also one of our hosts here, representative of the German Federal Ministry for Education and Research, Dr. Joachim Klein, will present the view of his experiences. He brings it with him from three highly different areas. During his doctorate in biology, the research, later on for work in a biotech company, also the experiences of private enterprises, and then since 2008 in the ministry, at the moment responsible for the areas as deputy head of global and public health and environment and health. Yeah, we are listening to you.
Yeah, thank you very much for this kind introduction and for inviting me to add some perspectives from a governmental research funder. I can keep it short, actually, because a lot of things I want to share with you have already been said. And that is, I think, a good sign or so, because we have different perspectives, but still we come to the same conclusions. So, and let me make also an opening comment. We are discussing today in the context of global health, but what we are discussing, I think, is also very important for our national health system, because are the same challenges in our national health system, and that makes also clear that our national health system is part of the global health ecosystem. So this is often not considered. So I will, according to our experience, so what is important is that the funder, and in my case, the research ministry, is really engaged in funding research for global health. So that is also true for the German government in total, and is somehow related to the governmental strategy. This is the strategy of health research, the global health strategy of the federal government, and also takes in consideration the EU strategy on global health. So this is somehow the framework which we need to work in. And then the next point I want to mention is the continuity and reliability of research funding. I don't think that 2 years programs, 3 years programs make a lot of sense in the global health. So you need also in project funding a reliable funding activity. So we recently continued 3 of our major research funding activities. This is EDCTP, which we are funding since 2003. These are the product development partnerships we renewed, which we are funding since 2011. And also our research networks in Sub-Saharan Africa is going into the second 5 years funding phase. So I think this kind of continuity and reliability is important to be successful. And then what we experienced also is that especially in global health, we need interdisciplinary and multi-sectoral research approaches, because coming out of the silos helps to get new ideas, helps to really be successful. And I would like to mention also this because it was the idea when we started to fund GLORA, because we thought that the global health community in Germany can get more successful and is can be involved much more in global health issues if we overcome the silos of, let's say, medical research by including public health, societal research, also engineering. So this was the idea behind one of the ideas behind GLORA funding. And on the other hand, GLORA now has more than 1,000 members, and for us as a ministry, we cannot interact with 1,000 individual researchers. But with GLORA, we have now a framework for interacting with all those stakeholders. What has been said is that we need to engage early with stakeholders from the beginning on. And that's something we had to learn, and we really learned that it makes sense if you plan a new initiative, if you are planning to start funding, involve all stakeholders, not only the researchers, but also those, as has been mentioned before, that at the end have to implement. Because often we as funders, what has also been said, are very interested to fund high-level, high-end research, but that may not address the real questions. The real questions are brought in by the other stakeholders in the planning. So apart from these general remarks, now I would like to add some topics that we are asked quite frequently, because obviously there's always some perception that within the government we are not always very well coordinated. But I can assure, within the area of global health, we really talk, we really coordinate, and we really align our activities. I can give you a few examples. One is the area of One Health. One Health approach, which is very important for global health research, is a topic within the whole government here. We have 6 ministries that signed One Health research approach or strategy, and we are really having a global health coordination group which meets every 2 weeks within the government. So I can assure that in this area at least it works really well. And this is, I think, only the first step. What we need is also, of course, a better international coordination. And the German government is a strong supporter of multilateral activities, for example, in the G7, G20, and also in the WHO. I would like to mention also the ongoing negotiations on a pandemic agreement and on the international health regulation, where we as German government are involved, and we are a member of the so-called Team Europe, and we like to really make this a success. And by this I would like to end, and there was the question, what makes a success at the end? The success is when research innovations are really implemented, and we try to measure this, and we have to see only what is implemented will at the end make an improvement in healthcare and improve the overall health situations. Thank you.
They work by themselves. Yeah. So thank you very much to our speakers. We would like to start off the discussion with a few questions. And I think we have heard quite a bit about barriers until now. And I would like to start by actually asking something about enablers. And I would like to pose this question to 2 of our speakers, but ladies first, of course, also because we are a minority on this panel. So we will start with Agostina, and then I would also like to hear from Zubin on the same question. But I would like to ask you if you can talk a little bit about what you think are the main enablers to bring in research into practice and into policy. I like to talk also about practice and not just policy, because there is a part of it that is also about the practice of it, about bringing the work into community. So you can decide whether to answer at the practice level or at the policy level. And who takes the responsibility for putting these enablers in place in your context specifically? Thank you very much.
Thank you, Manuel. Thank you for giving the lady the first slot. So,
always.
So in terms of the enablers, I think that communication will be one key enabler, because if we are not even able to, as a researcher, so this is from the viewpoint of a researcher, if I'm not able to communicate with the policymaker, then really at the end of the day, the policymaker might not even know what I've been able to do. And I go back to setting the priorities. So we need to judge, or we need to communicate, we need to organize workshops. Again, when the policymaker is organizing a workshop, a conference, or a meeting, I need to sit in. I need to be on that round table in that room, so that together we can make those important decisions, or take those important decisions. Number 2 enabler, I think, will be maybe sometimes getting some, what I call them, translators, so knowledge brokers, because sometimes it's so difficult for a researcher to explain my data, my outcome to the policymaker. So probably out of smartness, I can get a knowledge broker to translate the information I have generated to the policymaker, so that they can bridge the gap between the researcher, myself, and then the policymaker. Then I think that the other thing will be about some political support from the policymaker, because you find these policymakers in government, institutions, in ministry. So I guess that it will be important for them to sometimes, speak on our behalf, that look, this is what the researchers are doing. This is what they've been able to do. So because government, I always say that government go and government come. And in my country, it's a maximum of 4 years. So within the 4 years, you really need to engage with a researcher so that at least I can help shape your policies. Otherwise, we will find ourselves in silos. And in terms of who even initiates that enabling environment, I think the policymakers are critical. Government, they are very critical. Research institutions, they are also critical. And sometimes international organizations, because in our case for the TB-DRS work, actually we had WHO come in. So these international institutions can also be number one enablers. Sometimes they affected communities themselves. We also need them to, come on board. Individuals with the global health challenge, probably related to an infection or a disease. I think that they should also, and then sometimes even advocacy, advocacy groups and NGOs and, some institutions can also support in this direction. Thank you.
Thank you. Subin, would you like to add something?
Sure, thank you. I think Augustina has said a lot, and a lot of the things are, of course, I've got to say, would be repeating the building on that. I think that one, of course, is the importance of co-creation. I think co-created knowledge is far more likely to anyway come into policy, and I think we really need to reflect on how we actually work with policymakers from the start to co-create this. I'd like to reiterate two of my points and then talk about a more long-term process that I think is important for this and who should do this. You pointed out to and asked the question of who should be doing what. So this whole thing of doing things differently, and it's sort of bringing about the mindset shift, I think is absolutely critical. It's easy to say this, but actually implementing that in practice is really hard. And the mindset shift of giving up control. And I think we need to actually have systematic ways of facilitating that sort of mindset shift. So in terms of supporting researchers to be able to do this, I think it's critical to actually have outlets in terms of journals that support this kind of work. Otherwise, if you don't have journals that actually let you publish, it's very difficult for researchers to justify this. We need incentives within universities to be shifted. That also take into account the policy relevance of work. A lot of universities do, unfortunately, it's still very difficult and challenging to get the same kind of traction for policy work as for academic research articles. And again, there needs to be some sort of outlets for that. And I think funders here also have a responsibility for actually incentivizing. Research funders have a responsibility for incentivizing the kind of flexible approaches, which may not produce the kind of journals with impact factor articles, but are producing knowledge that is nevertheless very, very valuable. And I think this is key in this flexibility can only also happen with what I've already said about trust. And I think, again, if you don't have trust, not only in the relation between the policymaker, the researcher, and the program implementer, all the knowledge that we produce is going to go to waste. And I think that to enable the sort of leap of faith that we're advocating with this flexibility, you really need to build trust between these different groups. And I think, again, here, those of us who work with policymakers and researchers need to really understand each group's position from the start and bring them together to build this trust through a co-creation process from the very beginning. But now coming to the long-term enabler of this, creating the culture of evidence use, I think it's not going to happen overnight, and I think we need to be very cognizant of it. And we need to sensitize, create a critical mass of policymakers to deal with the sort of political turnover you're talking about, right? I mean, if we don't create this critical mass, we're going to inevitably end up with that one policymaker leaves, the next one comes in, we're again back to square one. And we also need to look very critically at incentive structures within policy-making institutions. Are there ways in which you can actually get policy-making institutions to begin with things such as a checklist? It starts with a very basic thing, right? Has this policy proposal reviewed the evidence. And I'm not saying this is a magic bullet, but it creates that sort of culture of evidence use. Over time, you can go to things such as mandating evaluations of large-scale public programs over a certain threshold budget, but other ways to actually create this culture of evidence use. And finally, if we're really going to be sustaining this, we need national level funding for this. It has to start, because otherwise, if it's going to be a project basis of creating these evidence ecosystems, to sustain them is going to be very hard. And I think co-financing mechanisms to actually start doing this as countries go up the income ladder is also a critical way in which actually you can sustain this at national levels.
Yeah, thank you. Yeah, so far our speakers spoke mostly actually on national health systems and the experience from India, Nigeria, Ghana, and Germany. Now we want to go to the bilateral or multilateral level and ask what does it make a difference if you work in this kind of setting? So how can we really facilitate governments and research this kind of international, be it bi or be it multilateral cooperation? And this question goes to Ifedayo and to Joachim.
Minister always.
Well,
Minister tomorrow. I'm the minister, not today. To our experience, this cooperation happens at different levels. So I mentioned before, there are these kind of high-level state interactions like G7 or G20 or at the WHO level, and on the other hand, there are those individual contacts that do exist, and I understand the role of the funder as a kind of facilitator. So what we can do is to help to align with the regional, national agendas. So I may illustrate it with one of our funding activities as an example. We are funding this research networks on health innovation in sub-Saharan Africa. Setting up this included what I mentioned before, already the stakeholders in the regions, and what is important, all these consortia we are funding are led by African partners. So this is for us a key for true partnership. Not North agenda for South, but South agenda for South. So those researchers and policymakers that are included from the South are those who know what is most needed. And they are setting the agenda, not we. We are just giving the framework. And that is what to our experience, is working best. So that means that the intention is, of course, also to strengthen North-South collaboration, but at the same time to foster South-South collaboration. So the countries that are involved in the consortia should build up their cooperation, and we are only facilitators. So that's what we try to be, not those who set the agenda, but who facilitate that the researchers and health services that are in the regions can innovate, can come to their innovations. And I have to say, apart from policymakers at high level, I think the public health services are very important. So those that work on the ground, not those that are in the ministry or and because those that work on the ground in the health services really know what is necessary, and they are the ones who have to implement at the end the innovation. So that's what is our experience.
So there are skill and number gaps across the entire chain, which need to be addressed or which need to be accounted for in strategy, and perhaps an opportunity for the multilateral or bilateral interactions also is to achieve better coordination, because I mean you do have multiple entities, interested in the same subject, but not coming together. So you got multiple entities trying to reach out to a southern partner or southern ministry and discussing the same subject. So, for example, at the NCDC, I've told partners, you know what, you guys go have a conversation and decide and let each other know what kind of support you are providing aligned, then you can come and have a conversation. I don't want to have the same conversation with 4 different people, and then because I'm interested in scale and not salami slicing or small projects for greatest impact, and that works a bit better. The second opportunity, that needs to be overcome is no matter, it is important that in the South or in the less resourced countries that we also put forward our own resources, because no matter how well-intentioned, as long as money flows as one unidirectionally, there's always an assumed hierarchy or the locus of power is different and, the agenda is, but there's more ownership if you're contributing no matter how small, to the pot. And I think this is also one of the arguments we continue to make in-house about, sort of government putting its own funding, making its own funding available. Your funds are best used for your own priorities as well, and perhaps may even attract a better return on investment in terms of, okay, you're doing this and somebody is more willing to work with you because you already have some investments in this space. So I think those are the points I'll add to what's been said already.
Yeah, thanks very much. Yeah, let's talk a bit about learning. Yeah, learning from the past. We do not have to start from the scratch, reinvent the wheel, but there had been always previous experiences. But as Augustina rightly said, governments come and go. Yeah. So how can we secure from the side of for example, science or development partners, that the learning from the past, from failures, from successes, is really brought into the actual policies? That's something I would like to ask Zubin, actually, from his experience.
Thank you. A very interesting question. I think we have to understand first why this learning doesn't get recorded, or why we don't actually have this learning readily accessible. And I think, of course, we've talked about the high staff turnover and departments move. A lot of knowledge is tacit knowledge. And I think there's a need to really find ways to capture this tacit knowledge. The other thing is that a lot of the tacit knowledge, so one is, of course, the recording of tacit knowledge. The second is a lot of knowledge is in reports that just gather dust on shelves of ministries of health. They're not indexed. There's no sort of collection of them to access. It's a challenge to actually be able to retrieve this information. So for the first, we've got things such as communities of practice, and I think it's important to encourage these communities of practice to actually work together, systematize this sort of tacit knowledge through engagement, putting it down, making these experiences and reflections actually written documents that can be then stored and knowledge to be there despite staff turnover. We can try to change the incentives of staff turnover. That's a bigger battle. We should continue to do that, but we have to also do this. We also have sections in journals which do this, and in fact, many journal editors have said they actually struggle to get submissions for these sections on policy and practice, innovation reports, which aren't really peer-reviewed in the same way. They're peer-reviewed, but they're not held to the same kinds of research standards. They're more like reflection pieces. And policymakers need support for some of this writing, support in terms of bringing it to the writing up to that level, but also they simply don't have time for this. So we have to, development partners and research partners actually can do some of this. That's sort of supporting the bringing together of communities of practice and supporting people to develop these innovation practice reports. In addition to this, for the reports which lie around, as I mentioned, I think we can have repositories of knowledge created in countries at subnational levels in large countries. We actually bring these sort of reports together on online platforms, have keywords, have them searchable so that staff in ministries of health are aware that they can actually go back to this and have a place they can find this relatively easily. And finally, I have a reflection about failure. And I think there's an important thing that no one wants to actually talk much about failure. So there's no one's incentive to talk about failure. If you're a policymaker, you probably, yes, you want to learn from it, but you're not something particularly proud of it necessarily. You're a development partner, yeah, you'll want to know it in an evaluation, that's fine, but again, you don't want to trumpet to your parliament that you put in hundreds of millions of dollars and it failed. So I mean, I think we need to face this before we understand why this, it's not by accident that we don't know much about failure. And I think, again, we need to change our incentives. I mean, I've had people talk to me about how we need a journal of failure. I mean, I don't know how many people would be proud of publishing in that. But we do need spaces where failures are systematically recorded and understood of why they are there. Similarly, in the funding ecosystem, we need them framed in a way which is not so negative, but to actually support studies on why projects don't go so well when they don't go well. And I think this is sort of critical if you're going to actually learn without just reinventing the wheel each time. That's it from me.
Brilliant. Thank you.
So, I guess in a way this comment on failure relates, I want to say to the next question, but not quite, because the next question is about really the everyday practice of our work and the challenges we face in the everyday practice of our work. And the question I would like to invite Agostina first, as before, and then Joachim to answer. So what are the challenges you really face in conducting your work? So we've talked a lot about enablers and challenges at the higher level, but what are the challenges you face, and what do you see as possible solutions to overcome these challenges?
So from the viewpoint of a researcher, funding. And funding, because you need the cash to do the work.
She reinforced it, notice.
Yes. So funding is critical, and I think that one of us said that it's important for government, local government, to probably dedicate some funds, because the funder or the funding agency may have their own interest. But if it comes from our national government, that sort of feeling that, yes, you have done it and it belongs to you is important. So funding is one. And then time. So if I have an interest and I want to reach out to the policymaker, I don't know, they are super busy. Of course, scientists are also super busy. So that committing their time to our engagement, vis-a-vis communication and all those things also is important. In my normal practice, I think I am so interested in my career advancement, so that within the university, I need to be promoted. And my promotion may not be based on writing policy briefs, unfortunately. My promotion will be based on publications. So there's that disparity and that confusion. Should I really tilt towards the policymaker, or I should rather focus on my career advancement? And in terms of mitigating it, I think sometimes I need to be selfish, which I do most of the time. And then occasionally, I will also, so like the TBDRS work we conducted, we sort of not really pleased, but we worked hand in hand with the policymaker. We got our papers, we got our publications, and they also got the information. But sometimes, because of my career, I also need to look within, and this is truth. Like I said, what we find in books really is not what we see in practice. So from my point, this is what I do. Sometimes I'm selfish. Other times I also try and, do a bit of a balance. Thank you.
Yeah, I mentioned before that I think for collaboration, North-South collaboration, true partnership is very important, and that is the basis for good collaboration. On the other hand, we have to be realistic. That means we do see cultural differences, and this leads also sometimes to misunderstandings. I mentioned before the funding initiative Health Networks in Sub-Saharan Africa, which we had kind of external evaluation throughout the 5 years of funding. And it turned out some of the problems really were misunderstandings due to cultural differences. This is not very astonishing if you have 14, and in this case, 14 African countries involved, collaborating with German researchers in 6 different consortia. There are simply misunderstandings which we have to overcome this. And then we also have to be realistic that resources and infrastructures are not the same. Of course, it makes a difference. Although you are in a true partnership, if you work in a African setting or a German setting, it's not the same situation. And that is also why we think the funding mainly goes to the African partners. In this case, 80% go to the African partners because there is more need for funding than here. And it's what I also want to mention is that, for example, in those negotiations for the pandemic agreement, I think we notice growing north-south disagreement sometimes. So the perspectives are different and the goals for the agreement are different, and it's very hard to find a compromise. And I think it's also, if you look at our national societies here in Europe or in the US, we see also splitting in society. So that's a problem that's also reflected, I think, in the global health ecosystem. And I really count on science. I count on science to overcome these social differences and problems, and I hope that scientists will really cooperate and find solution for those problems.
Now I feel very heavy. As a researcher, I'm saying count on science. So.
No, you are doing that, exactly.
Our last question goes to Ifedayo and looks at the future in a way. So our last question as a panel, and then we will obviously open to the audience, and looks at the future by saying we do have some current initiatives, but we're also in a time of change, facing new global challenges, such as, for example, just to mention one, climate change. And so looking at the current initiatives, how do we have, if at all, how do we have to adapt such initiatives in the light of future global challenges? Do we have capacity for innovation? And do we have the resources to sustain such innovations? Difficult question, I know. That's why we gave it to you as the closing one.
Okay. So the again, it's in life in general, your sort of the philosophy is that you don't make all the decisions about the future based on your current situation or how you feel now, or how you felt last night before you went to bed. You don't decide whether to, what you do today. And for health in general and health security, we have to plan for the future, and of course, preparedness, readiness, response. You need to consider all sorts of variables, and climate change is one of, basically an existential threat to life. But it's health. It's one health, So if you've got a threat to one health, to the environment, to animal and the human health space, you've got to take that into account in your planning and in your response. And so the opportunities to do that, or the challenges that, if we say would prevent us from doing that, includes sort of that ability to adapt, and the already challenges with resilience in systems. Okay, so everybody, COVID did everybody solid. In the other, looking at it from another angle, even, countries that were supposed to be the best or most ready had challenges. But I think the big difference, again, is the difference in resilience in systems. People immediately started to respond, we quickly, people developed ways of doing studies, and were constantly refining management of patients, expanding, the patients need to sleep on their sleep prone or supine, and so on and so forth. Whereas even in our parts of the world where maybe we were less hit, the challenge with resilience, with critical care capacity, space, and things like that, meant that despite having fewer cases in terms of severe cases, we had significant higher mortality rates than even countries in the West where there were a lot more severe cases and hospitalizations. There will be a need to invest in advanced data analytics, data management systems, all the modeling, all the forecasting, and all of this stuff you need. Sometimes you're so bogged down by the operational day-to-day operational issues that it's difficult to really plan for the future. So we need to, and even speaking as an agency, where a strategic interest for us is to build capacity in big data analytics, modeling, and forecasting, and the like. But we overall also have to develop, what I've described as climate smart healthcare. So it's not just health security, but everything else, clinical care, primary health care, even aspirations for universal health coverage, all have to be sort of climate smart going forward as well. And whether we like it or not now is national governments overall, whether you think you're responsible for emissions or not, you do now have to commit resources to climate change, things like the policy bit of work, the collaboration, and of course the innovation and technology that is required. So I think this is some of the areas that require a bit of consideration or change or investment, or represent opportunities to address as far as taking on board the impact of climate change on health going forward. We will probably all be able to tackle it with different speeds, but I think we just need some forward motion, basically.
Yeah. Many thanks to all discussants here on the panel. And due to the great timekeeping, which is not always the case in cross-cultural encounters, we really have the opportunity for some questions, experience from your side. Please give us shortly your background that we can really see what experiences are behind it. Yeah, Velavan. And then.
Thank you. I believe I'm audible. Yeah. Professor Velaban from Institute of Tropical Medicine, University of Tübingen, and also a GLORA steering committee member, and being working in Africa as well as in Southeast Asia, born in India. I've thoroughly enjoyed all your discussions very well. I would like to take the notion from our brother from Nigeria, who have clearly said an academician can become a policymaker, and policymaker never want to be an academician anymore, which gives to the point that the proportion of policymakers are far too little compared to the researchers or the academicians per se. I would like to pose the question to our brother Jubin from India. How do policymakers respond during an emergency period or an outbreak situation when there is no evidence is available? I can give you a best example. For COVID-19, during the early COVID-19, we don't have any therapeutic measures. We have used lopinavir, we have used ritonavir, we have used hydroxychloroquine, we have used remdesivir. And there's no any therapy available, but most of the patients or most of the COVID patients died because of just hospitalization per se. How do policymakers respond when there is no evidence? Do you look up to the north, or you do look up to the south, or you look around, and it's a mass movement that you follow? Thank you.
So, yeah, thank you. I mean, I don't think there's a straightforward, simple answer to what people do in such a situation. I mean, I can only reflect that I think that in such a situation, you're dealing with clinical guidelines. I don't think in clinical guidelines are similar in the same way as some of these policy questions we're talking about. I think there's a much clearer case for looking at guidelines from other settings and being more directly applicable than there would be in the case of the kinds of policy implementation questions where context is certainly more important. I mean, the human body is not going to be dramatically different in different settings. So I do think that there is that broad framing, but what I do also think along with it is that you do have to look at having capacity for doing sort of rapid reviews in your own setting that can actually bring together learning from your own settings as you're doing this. And I think that sort of is what I would recommend in that case. But with the full disclosure that I do not really work with clinical guidelines and clinical practice, and that's not really the field in which I am trained in or work in. But that's what I would give as your first advice.
Second question was there.
Yes, thank you. I'm Anna Neumann. I'm speaking as an MD candidate, an open science advocate, and currently a public policy student. So I deeply care about that nexus between research and policy, but I'm also growing up in an academic system where that is not credited. And Zubin and Augustina, you pointed to that in your contributions. But then I would argue that our best bet to go about a mindset shift, which you said, Zubin, is early career researchers. So I would like to ask you, what can you do in the different positions that you are in at the moment? I'm looking at professors, I'm looking at policymakers, I'm looking at funders, to create that space for early career researchers to learn how to communicate their science, and really develop these skills.
Ladies first.
Yes, so thank you. I think early career researchers, they are very important. And at least as for the older ones, it will be so difficult to change them or to mend them. So our best bet will be the early career researchers. And I think that training will be very important, especially if you are the straight-jacketed science student, then you may want to incorporate some policy engagement activities and studies. Same way, as a researcher, you also need to learn how to communicate using, the policy way of communicating your research. So I'll look at education, some training activities for early career researchers. And thankfully, I did that at a point in time. And so in the heat of the COVID, when the policymakers were doing their own thing, saying their own thing, at a point in time, they had to fall on the scientists. And as a scientist, you don't speak what you don't know. You speak to facts. And I think that we blended so very well with there were some few issues, in the beginning. But I think at a point in time, we all slowed down and we sort of plateaued. So I'll look at education, and again, I'll also look at exposure. So the early career researchers also need to sit in some of the meetings to learn the language. Because if you don't know the language, whether the language by the policymaker or the researcher, then it becomes very difficult for you to communicate. So let's expose the early career researchers. Let's give them that formal training or informal training. And I guess when it gets to the time when they are in a position like the big boss or the minister, they will be able to, judge with either the researcher or the policymaker. So this will be my thoughts. Thank you.
I don't know whether I'm old or young. I'm not quite ready to be discarded yet, but I think so overall the few issues as they affect you is the big challenge for researchers and for academics, early career, otherwise, is that the metric of measuring success or assessing success is completely disconnected from policy and all of that. And maybe that's not relevant to you if you're an immunologist. Yeah, but if you're an infectious disease epidemiologist or a public health researcher who really wants to bridge this nexus with policy, then we have to do something about that. And I think the older generation, well, I'm not that old, but the professors or those of us who have perhaps gotten to the top or near top of the ladder do have a role in trying to change the assessment system, okay, to make sure that sort of all relevant outputs or value that can be derived from the research that we do contribute to your assessment as, to move from one level to the other. That's all I'll probably add to what she said, because yes, the early exposure is key. Being deliberate, being intentional about learning how to communicate. I mean, you have to, the soft skills, you have to have the media training to even learn how to speak. Then you have to, I think we focus on the media training and we miss out on more of the policy engagement training bit, which sort of teaches you how to speak to policymakers and government. And you do need to connect with the communities to understand context and, and where what you need to do fits into community needs and the like as well. I think it's a response to the first question. So again, that's the general issue about which knowledge or whose knowledge has value. Okay, so the historical setup of global health is that there is a north to south whatever, and the South does not necessarily tell its own stories. And of course, we've got a saying in general that, as long as the story of the hunt is told by the hunter, you're never going to get the animal's perspective. This guy, I took one shot and I bagged him at 1 kilometer away or something, but it might have just been, look, I was weaving and I weaved into the part of the bullet, as the narrator said, it was just lucky. So one of the things we try to do deliberately is to tell our own stories, write our stories of our experience. And thankfully, there are journals now that are, taking that on board. But I also recognize that that's easier for me to do. If you're a mid-career person who needs to get all these nice papers in journals with relevant impact factor to guarantee your next grant, you've got a slightly different problem. And the worst part of this is that I had this complaint about my senior colleagues who said, just put it in +1. I'm thinking, yeah, you've done all the Lancet publications. You want me to send my work into +1 or something. But, so some of these things need to change, and some balance needs to be found somewhere. That also doesn't completely discard innovation and sort of research that contributes to progress and that we also need for society.
Good afternoon. Oh, okay. I think I have the microphone. Sorry. I'm Dr. Collins Adeyanju. I'm a researcher from University of Erfurt. I just wanted to ask from the Nigerian and the Ghanaian on the panel, if we are not missing an opportunity using the ethics decision review board within our system to also address, this transparency policy, research policy goal. Because I have this experience in Nigeria, in Malawi, in Kenya, in Tanzania, recently in Cameroon as well. The ethics committee requirement for, approval of protocols require submission of reports, post-study. Sometimes, or most cases, they don't follow up. And eventually, when you have them available, they don't link these findings to appropriate quarters where they will be relevant for policy making or for decision making at policy level. So the question is, how can we use the ethics committee of these various countries to serve as a bridge between transferring this knowledge that have been produced to this to the policymaker, in the sense that, yes, we may not have, of course, the policy brief, Dr. Aditifa talked about it earlier on, in terms of the lengthier it is, the less likely it is to be used. So can we leverage on the various institutional review board that we have in our various countries that approve these studies, and when we submit these findings to them, they channel it to various agencies, if it is disease control, if it is immunization, various departments that these findings will be most relevant for. And as a result of that, we are finding the research connecting to factor into decision making at policy level. Thank you.
Okay, so quick one, and it's interesting, I have been sort of on ethics committees, and I think it's important to understand the reason why they have that requirement. Okay, so it's to be sure that the studies were actually done and there is something in return. So it's not I don't think that you can give that the additional responsibility to ethics committee to assess the end of study report or policy brief for suitability for the consumption of the policy maker. I think you need to separate the process, and there's already enough of a challenge in that space that I'm not sure that as an ethics committee member that I want to take on that additional responsibility. So I think the IRB role is straightforward. It's protection of the interest of the study participants, and to make sure that you actually did what you said you did in the way that it was approved. That's the summary of that function. Yeah.
Hello, my name is Raphael Cannon. I'm a French medical student, and I'm part of the youth delegate at this summit. First, I'd like to thank all of you for these interesting discussions. That's some really wise words that will maybe follow me for the rest of my career. So thank you very much. My question is about the place of youth researchers and young people in our today's general topic. So I would love to hear from your experiences. I think they're really valuable. About the question, are the young people involved in the policymaking process in your countries? And if yes, how are you supporting them to be meaningfully engaged? Thank you very much.
Who wants to answer?
I think what we are trying to do is to encourage young people to engage, also by, for example, going into boards, nominate themselves, and be conscious of what they can really do. As a funder, we also have funding modules for young researchers, and that is also to give them early in their career their own money so that they can take the decisions, they can build a group, and this is, at least in the German system, often you can't do this before you are a professor with 40-something. This is very late. So we try with other modules really to give also younger researchers a chance to take their decisions with their own funding money. And what we also have maybe to improve is, we were talking about the currency of science, recognition, and so this is difficult to change, but maybe we as funders could include more young people in our review boards, because the review boards are those that decide at the end who is going to get the funding. And if you want to have the young researchers' perspective, it's not always good to have only very experienced researchers, but you may also include young researchers in those review boards. That's what I think we could immediately do.
So we would like shortly to leave the role as chairs and say that become part of the discussion that GLORA is really going new ways, funded by BMBF on this. We have this GLORA Academy for the support of early career researchers, and we have also a special seat in the steering committee for the early career researchers. So we really try to overcome, besides other ways, equal gender balance and all this, really the traditional ways of selections and decision making in research funding.
Maybe I can just chip in that I'm an example. I don't think I'm old, but but at least I sit on a number of boards in Ghana. So thankfully, I sit on the National Tuberculosis Control Board, the advisory board. I sit on the National Coordination Board for COVID-19 testing, and there are a couple of other boards. And I think that as young people, we need to make ourselves visible. When we attend a meeting, grab the minister, because that's the only time you'll be able to have a chat with the minister and talk about important things, talk about your research, and talk about the other things you feel can directly impact policy. So let's make ourselves visible. I'm with you. Thank you.
So unfortunately, at this point, we have to stop the discussion, but you can ask your questions afterwards to the panelists, I'm quite sure. And the last round, we just agreed will be very short, just one sentence, a take-home message for the audience. Who wants to start?
I just used the opportunity to address the last question. So, I'm thankful I've got an agency full of mostly young people, and I tried, and I've got an office that is staffed by really young people. These are people who are mostly younger than even my youngest sibling. And the idea is to also be deliberate about giving them opportunities to for responsibility, to witness the whole process of executive office, and then to be at meetings such as this. Obviously, there's a challenge of budgets and all of that, but we encourage abstract submission. We try to provide institutional support or even find sponsors to provide support and to give as much domestic, local, national, continental, and international exposure as the case may be, so that they've got the confidence, they've got the diverse experience that they require to succeed in whatever track they decide to follow in their life. So it's long last words, but thank you.
So yeah, I just try to reflect on two things I think for the evidence to policy theme of this. I think one is, of course, the importance of global actors to coordinate with each other, as Fidayo said, and to actually align with national funders. And the second is to allow for experimentation, give space for experimentation with new approaches to do this. I think these are two things which I would emphasize. And last is about one thing which hasn't been spoken, about moving capacity strengthening really from looking at only individuals to institutional capacity strengthening, giving spaces for people to actually work in that can enable sort of sustainability that we've identified as a challenge.
Okay, I'll make mine very short. Let's get out of our silos as researchers and as policymakers, and let's work together. Thank you.
I like to quote Augustina. She said, "Governments come and governments go, but I can assure you administration stays." This is kind of, for me, a picture, a symbol for continuity, and I would ask you to go for your goals. Don't get disencouraged by daily politics, but perseverance is important, and if you are continuously working on global health research, I'm sure you will be successful.
On behalf of Walter and myself, we just want to say a huge thank you to all of our speakers, to all of you for being here. And if any of you doesn't know about GLORA and is interested to know more about GLORA, you can approach us or Maeve or Nora, who are also here in the audience with us. Thank you very much.